If you don't make time for your wellness, you'll be forced to make time for your illness. It's Benjamin Franklin that's asked the question, do you love life? Then do not squander time, for that's the stuff that life is made of.
Okay. Well, Mollie, I want to start from healthy lifestyles. Give us practical tips.
Diet, or a diet that is high in sugar, added sugars. It contributes to conditions that can increase your risk of cancer. It's all about moderation. It's all about moderation. Another thing I'd like to touch on is the issue of processed meats and smoked meats. And this increases the risk for cancers, particularly colorectal cancer and stomach cancer.
I remember there's somebody I saw recently who was taking some of these energy drinks and all that, takes at least one per day. Says she cannot function without it. What's going to happen to your kidneys in the next 3 years? And now I want us to talk about stress.
So stress is the body's natural response to challenges. Stress is a key driver for anxiety and depression. So when the brain perceives stress, what happens is it activates a pathway. There's a pathway called the hypothalamic pituitary adrenal axis. Things like water, staying hydrated, because usually fatigue is worsened by dehydration. But when smoking remains one of the leading preventable causes of disease and premature death worldwide. Smokers
are liable to die young, but they're still advertising it. What does that mean? These people don't really care about our health.
So I'll first start by saying that WHO has said that there is no safe level of alcohol.
All we're trying to do is to inspire somebody, to motivate somebody that listen. With knowledge, you can break that power of addiction.
It's a good time to just stop and rethink, and be intentional about your choices, because prevention is not just the best medicine. It's God's wisdom in action.
See, we can use time to advantage. Proverbs 22 verse 3 says, a wise man, a prudent man foresees evil, and then he hides himself. The medicine of time. Hello everyone, welcome to another episode of Doctor's Ministry Podcast. Thank you so much for joining us again today. Our guest today joins us from Canada. She's a family and emergency medicine physician based in Canada with rich experience practicing both in Nigeria and across Canada's urban and rural communities. She provides care for patients of all ages with a special focus on supporting the elderly in long-term care facilities. Beyond clinical practice, she is passionate about mentorship and postgraduate medical education, guiding international medical graduates as they transition into practice in Canada. She holds an international master's in healthcare leadership from McGill University, where she specialized in applied healthcare leadership. Her commitment extends beyond the clinic. She actively participates in missions across Africa, the United Kingdom, and other nations, using her gifts and resources to serve the purposes of God. She's deeply committed to building stronger healthcare systems and enjoys sharing how timely steps can transform long-term health outcomes. Join me in welcoming Dr. Mollie Atainyang to the show. Hi, Dr. Mollie. Good to have you.
Hi, Dr. Mena. Thank you so much for having me.
Yeah, Dr. Mollie, it's so good to have you today. We're talking about something that's very important and crucial, and that is the medicine of time, exploring the science of primary prevention. Dr. Mollie, you're an expert in this field, so hopefully we're going to gain some insights from you and learn how time can become an advantage in preventing certain diseases. You see, time is of the essence. Now, the Bible says in the book of Proverbs chapter 22 verse 3, it says, a prudent man sees danger ahead and hides himself. It says, but the simple pass on and is punished. What we're trying to do here is to learn certain things, that we can, certain habits we can give away, certain habits we can develop in ourselves that can help prevent certain illnesses. Moses says something very powerful in the book of Psalm chapter 90 verse 12. It says, teach us to number our days that we might apply our heart unto wisdom. I believe that if anybody that understood time was Moses. He spent 40 days on the mount with God, doing nothing else but just being with God. When he came down, he made this powerful proclamation. One of the things we're trying to learn is, what can we do today? What are the things we can do today, be it food, habits, exercise, or whatever, or seeking the doctor early that we can do that can help prevent some of these particularly non-communicable diseases. Dr. Mollie, primary prevention, that's what we're talking about today. What are your initial thoughts?
Thank you so much, Dr. Mena. It's such a pleasure to be here on this podcast. So my first thoughts would be, if you don't make time for your wellness, you'll be forced to make time for your illness. And this is just the very essence of the medicine of time. The understanding of the choices that we make today will determine the quality of our health tomorrow. It's Benjamin Franklin that asked the question, do you love life? Then do not squander time, for that is the stuff that life is made of. Preventive medicine is a practice of using time wisely. It involves taking practical steps to prevent diseases rather than waiting to treat these diseases. And it's a cornerstone of modern medicine. It not only reduces the burden of disease, but it also enhances our quality of life and prolongs life expectancy. So it emphasizes things like what you had just spoken about: regular screening, healthy lifestyle habits, immunizations, and generally just early interventions, that will protect long-term our well-being. In a world where chronic diseases and non-communicable diseases continue to rise, medicine of time reminds us that prevention is not just about extending life, enhancing the quality of each moment that we live. And for us Christians, as Christian physicians, actually, this aligns with our biblical call to steward our bodies as temples of the Holy Ghost, caring for our health in a way that is good and saves others. So this is what this is all about: being proactive and focusing on actions that will prevent illness in the long run.
Wow, that's a very powerful introduction, Dr. Mollie. Now, you said something I want to pick on. You said if you don't make time for wellness, you will eventually make time for the illness. And this is the mistake we've seen many people make, over time as a result of ignorance. And they say we grew up in Africa, and there's usually this popular saying, and they say disease not the care African man. It's become clear that statement doesn't hold true anymore, because some of the things that we think only affected, the developed nations, or it was disease of the affluent, are creeping in already and beginning to, affect us. It doesn't matter anymore. Many years ago, we thought cancer was not really a thing, but now it's becoming more prevalent, even among Africans. Hopefully, that's some of the things we'll touch on. How certain lifestyle changes, can lead to wellness later on in life. And like you said, it is beyond quality, it is beyond quantity, it's beyond extending life. It's the quality of it. You see, we want to live healthy, and God expects us to do so because of the assignment He's committed to us. Yeah, Dr. Mollie. So primary prevention, I know there are different levels of prevention or preventive medicine. I want you to throw some light, comparing primary, secondary, tertiary, and how important primary prevention really is.
Okay, so just like you said, there are three main levels of preventive healthcare: the primary prevention, secondary prevention, and the tertiary prevention. The primary prevention is actions that are taken to prevent the onset of a disease. In this case, we talk about things like vaccinations and immunizations to prevent infectious diseases, or things like what we're doing right now, health education. Right? And then for the secondary prevention, what we talk about is the early detection of a disease before the symptoms are noticeable, so that we can prompt treatment. In this case, things like screening exercises, for like mammograms for breast cancer, and pap smears for cervical cancer. And then there's tertiary prevention. This is when the chronic disease is already existing, and it talks about managing this already existing chronic diseases to prevent the disease worsening, right? And to try to improve the quality of life of that individual as much as we can. So, for example, rehabilitation in a stroke patient, that will be a form of tertiary prevention. But I think our talk today mostly is on primary prevention. What are the things that we can do to prevent the actual onset of a disease? And there are different strategies to primary prevention. And if you like, we can just delve into that in it.
By all means, yes, please.
Now, the different strategies for primary prevention, like I mentioned, the very first one would be exactly what we're doing now, which is health education. So encouraging the awareness of risk factors and empowering individuals to make informed decisions. Right? The second strategy I would like to point out is immunizations. I know that this is a very controversial issue in many climates, but it is something that is important. And maybe on another talk, we can throw more light or shed more light on this strategy of immunization. But we must bear in mind that immunizations are very important, and they protect us from infectious diseases. Take, for instance, the case of polio that has been eradicated now or would we go back in time and mention smallpox, right? These are things that were prevented because people received their vaccinations. So and shed more light on this on a later date. Like I said, it's a very controversial issue, especially now. But that is one of the strategies for primary. Another strategy I'd like to mention would be something you had mentioned in the beginning when we started talking: wellness checks or annual clinic visits, where you go to your doctor to allow your doctor monitor your overall well-being, your overall health. It's in these visits that they get to check blood pressure. In these visits, they do blood tests to check your cholesterol level, and things like that, check your weight, and all of that. So this is another strategy for primary prevention. While most people believe that you should wait until you're sick to see the doctor, it is actually wisdom for you to submit yourself for an assessment at least annually to say, hey, can you just do a thorough check and let's see where I need to adjust or where I need to improve, and your doctor can help you do that. Now, this brings us to the fourth strategy that is the big strategy we'll be talking very more about today, which is healthy lifestyle. Right? So promoting things like balanced diet, physical activity, smoking cessation, adequate sleep, stress management. The list could go on and on and on. But these are the major strategies for primary prevention. And I hope that in this session, we'll be able to touch all of these issues, at least, and shed more light for our audience to be able to understand what we mean by these things.
Mollie, thank you so much for that insightful presentation. And you're talking about the strategies here, health promotion, and things. It's something you touched on briefly, which hopefully we'll deal with later on. The controversies around vaccines. And like you rightly said, we cannot deny the place of vaccines or the impact it has had, particularly in Africa. You see, polio and other things have been eradicated because of it. I know there's some conspiracies around it. Hopefully, we'll be able to throw some light into it. Now, you've just mentioned healthy lifestyles and wellness checks and all that. I think I'm particularly interested. I'm curious. The Bible says that in Galatians chapter 6 verse 7, it says, "Do not be deceived. God cannot be mocked. Whatsoever a man sows, that he shall reap." This goes across spiritual, physical, social, whatever. You see, so hopefully, what we're trying to say is that give information such that we can begin to sow the right seeds. Okay, ignorance is not an excuse. See, that we are ignorant does not necessarily mean that you are going to be free of the consequences. Okay, now, Mollie, I want us to start from healthy lifestyles. You talked about physical activity, balanced diet, and all of that. Maybe you should give us practical tips, to help us, because I'm learning as well. I'm kind of curious because, of course, we don't want to be caught later on, and then just regretting, if I had known, I would have done this, I would have done this. And I know the context of everyday living, can sometimes make it difficult for us to imbibe some of these things. But then, by being intentional, I believe that we can develop it. So, Dr. Mollie, please give us practical tips in a way that we can understand simple things that can help us, do these things.
Okay. So I think we'll start off with talking about our diet. Right now, WHO recommends that when we have a plate of food, say that plate of food is 100%, 50% of that should go to fruits and vegetables. The remaining 50% is what you split between whole grains, low-fat dairy products or protein, and then water. But times we split our food the other way around. It's a lot of carbohydrates, lots of protein, and then less of the vegetables and fruits. And instead of water, we replace it with sugary drinks. Now, this is one of the things that we need to talk about. So things like brown rice, whole wheat bread, oats, those are what we call whole grains. And this diet has also been shown to decrease blood pressure or reduce the risks of hypertension, as well as lower LDL cholesterol, which is the bad cholesterol in the body. If we're to, make our plates look like that every time we pick up a plate of food to eat. Now, with regards to the sugary drinks or the high sugar content that people usually take in these days. I know that there's been some talk about a relationship between sugar and cancer. That relationship is quite complex, and very much of misunderstood. And while sugar itself does not cause cancer, a high diet or a diet that is high in sugar, added sugars, what happens is it contributes to conditions that can increase your risk of cancer. Now, the excess sugar leads to weight gain, and that weight gain leads to insulin resistance and chronic inflammation, all of which are linked to certain cancers like pancreatic cancer, colorectal cancer, breast cancer, And there's also studies that have shown that cancer cells are more likely or tend to use up sugars for energy than the normal cells. What is called the Warburg effect. That's how cancer cells actually replicate, And so it doesn't mean that you should cut out all carbohydrates. But what we're trying to say is we're underlying the importance of moderating and choosing natural sources of sugar over processed sugars, because they play a role in our overall health and well-being. So
carry on, please carry on. If I don't know,
I hope I was able to shed enough light.
That's powerful. Now, you're talking about naturally occurring sugars and then the processed ones. Is there any place for processed sugar? Is it to cut it completely, or is there any recommended quantity or something? Because processed sugars actually, are they healthy? Processed sugars,
they are unhealthy. Actually, it's better to go for natural sources of sugars, things like fruits and that have sweet juices in them. It's better to go that way. And even though some people may say it's almost impossible to do without, right? We do need these sugars. Our body needs energy, remember, and this is where we get energy from, right? The hydrates. It's all about moderation. It's all about moderation. Another thing I'd like to touch on is the issue of processed meats and smoked meats, right? Because I see that a lot of people, consume lots of processed, and this increases the risk for cancers, particularly colorectal cancer and stomach cancer. Now, the concern is about the chemicals that are released from these things during the smoking process. They are carcinogenic. What gets released are aromatic hydrocarbons, and what they do is they damage the DNA, right, and potentially trigger that cancer development. The preservatives that are used in these processed foods as well, bacon, sausages, and all of that, are another group of cancer-causing chemicals. And when they are exposed to heat, when we cook them, these chemicals are released. You see the risk for cancers as well.
So by processed meat, you're talking about is this soya barbecue and things like that? Wow.
Yes.
Okay. So you say it is linked to colorectal cancers and stomach cancer and things like that. I think this is very good information, because this is some of the things that we're exposed to, that in some cases we enjoy. You see, but what's going to happen down the line? You're talking about sugar stuff, processed drinks. Like you just mentioned that you look at a regular diet for some people, it's high carbs and all that, and it replace water with these sugary drinks. I remember there's somebody I saw recently who was taking some of these energy drinks and all that, takes at least one per day. Says she cannot function without it. What's going to happen to your kidneys in the next few years? You see, there'll be a problem there. There's even one of my colleagues who kidneys already affected and stuff, but she just can't do it. I said, this thing right here is a problem.
Yeah.
You see, but sometimes people either they don't know enough, or they ignore some of these things, and later on, it leads to long-term consequences. Like you said, we don't want to manage those illnesses. It's better to prevent it in the first place. Mollie, thank you so much for this powerful insight. I'm learning a lot. Now, I want to ask, what is the benefit of fasting? Does fasting have a place? Because I know that there are some benefits of fasting, but like intermittent fasting and all that. There's something you mentioned about cancer thriving on, sugars and all that. I think there's some that they actually research along these lines, and they're saying fasting sometimes can starve these cancer cells and halt the progression of disease. Is this a thing?
Yeah, so you already answered the question yourself. There's been some research to show that when we undergo fasting like that, what happens is, because there's not excess sugar for these cancer cells to thrive on, right? It starves them, and then, or it doesn't allow the progression or the breeding of these cancer cells. If there is some usefulness to fasting, and in fact, it's even advised to intermittently do that. However, we must not push it to the extreme, because there's also the risks and complications from it.
As much as everything, yes.
Right? So everything is about moderation, especially when it comes to our diet, right? And even exercise, everything has to be in moderation. Everything has to be in moderation.
That leads me to my next question. How much exercise is enough? Do I have to go to the gym? Are there things I can do? Is this the physical activity? How much is enough, and what is recommended?
Well, so there are various ways we can exercise, right? And there's evidence-based recommendation from the WHO for the different kind of exercises that an adult can undertake in. The first type would be the aerobic exercise, at least 150 to 300 minutes per week, right, of a moderate intensity aerobic activity. So things like brisk walk, swimming, cycling, right, all are moderate intensity activities. Or if you're going to be doing something more vigorous, then what is recommended is about 75 to 150 minutes per week of the vigorous intensity activities, right? Running, right? Or what most people do would be an equivalent of both. So you just split it in between throughout the week and do either or. That's one way. Another type of exercise would be muscle strengthening exercises or activities. And what is recommended is 2 or more days, right? Usually targeting major muscle groups. So what people call leg day. So like your legs, your hips, your back, your shoulders, twice a week, target these particular muscle groups and, perform exercises to strengthen these muscle groups. There's also flexibility and balance exercising for the older adults. This is usually to prevent falls and maintain mobility for them. Things like yoga, right? Or things like stretching exercises are recommended at least 2 to 3 times per week for these individuals. And in general, physical activity decreases the risk for cardiovascular events. It helps to release endorphins, right, when we exercise, and all of this help with our cognition, better cognition, decreases the risk of cardiovascular disease, decreases the risk of type 2 diabetes, decreases the risk of cancer too, improves your mental health, enhances your longevity. So exercise is good. Exercise.
Thank you so much for giving numbers and this sort of specification. I think is really, really clear. Now I want to ask for life is happening, work stuff and all that. So some people that are just their lifestyle becomes sedentary. They sit behind a computer for the whole of the day. Are there any recommendations for them? What are the simple things they can do to ensure that at least they're not putting themselves at that much of a risk?
So take frequent breaks, right? For example, if you have a job that requires you to sit at a desk for 8 hours during the day, it's important that you take breaks. Take short walks in between, stand up, move around, drink some water, get rehydrated. As much as possible, try to do that in between your day, instead of just sitting in one place or sitting, for long stretch of hours without moving any of your muscles at all. As much as possible, try to incorporate that into your day. It's very important so that you're not just without exercise at all.
Okay, thank you so much. And I think I saw somewhere that maybe standing decks as well, just so that you don't sit down for too long and all that.
Yeah, there are a few organizations that even make provision for those kind of things, right? Where they give you like stand desks so that you sit and then you can stand after a while and things like that. So people make requirements or recommendations for that. So people are able to get recommendations for that as well.
Okay. Thank you very much, Dr. Mollie. Now I wanted to talk about stress. You see, Mollie, life is happening, and there's so much effort into making ends meet. You see, so some people are having to do 2, 3 jobs. We've got shift working, disruption of the sleep pattern. People doing working overnight and then working during the day and things like that. What is the impact of stress on the body, and what are the strategies that you would recommend, for us to manage this?
Thank you so much for that question, Dr. Mina. So stress is the body's natural response to challenges or to threats. So sometimes acute stress is good because it gets your brain thinking, right? It gets you moving in the right direction. Where it becomes a problem is when it is chronic. And chronic stress has well-documented negative effects on nearly every system of the body. So when the brain perceives stress, what happens is it activates a pathway. There's a pathway called the hypothalamic pituitary adrenal axis. When that pathway is activated, what happens is cortisol and adrenaline is released. And it is this chronic activation that leads to the development of elevated blood pressure and heart rate, because these are the effects of adrenaline and cortisol on the body, right? It also causes increased blood sugar levels. It causes a disrupted sleep, like you mentioned, also causes a suppressed immune function for some people. And all of this contributes to the development of high blood pressure, development of heart attack, of stroke, through all the vascular tension that is going on as a result of the release of adrenaline and cortisol. When cortisol is chronically elevated in the body, what happens is it promotes abdominal fat accumulation. Now, this abdominal fat accumulation leads to insulin resistance and metabolic syndrome, therefore increasing the risk of diabetes. So you can see the cascade of events, that happen as a result of stress. And I mentioned stress also weakens the immune system, making an individual more susceptible to infections, and usually it's also heightens chronic inflammation, like I spoke about initially, that can also increase your risk of cancer, and chronic inflammation is also linked to autoimmune conditions as well. So stress is a key issue to address.
The vicious cycle,
is, and unfortunately it is now part of our lifestyle, regardless of whatever region you find yourself in. Everyone is always finding themselves in one form of stress or the other. Stress at work, stress at home, stress all around. And I must mention here also that stress is a key driver for anxiety and depression. Cognitive decline, because what happens is it impairs your focus. You're not able to focus properly, to carry out the tasks that you are supposed to carry out. So that's the key issue with stress. Now, what are the management strategies that are available to us for stress? We just talked about one very important one, physical activity, right? And we know that physical activity, like we just talked about, what does it do? It lowers the cortisol levels, it boosts, it enhances your mood, it releases endorphins that we had talked about, and these endorphins can also help improve your sleep. What research has shown us is that there's no one management strategy for stress. It has to be a multimodal approach. So you combine with lifestyle, cognition, behavioral therapy, all of these things to manage stress. So there's something called mindfulness and meditation that has also helped with the management of stress. And it was actually developed in the University of Massachusetts, right? There's a program called the Mindfulness-Based Stress Reduction Program. And it has shown in randomized trials that what happens is when you engage in these mindfulness activities, it reduces the level of anxiety. It reduces the level of perceived stress. And what's the techniques that we use for these things? Things like deep breathing, right? Things like muscle relaxation. These are the things that they engage in. And then finally, one other management would be something that has been explored extensively called cognitive behavioral therapy. What happens with cognitive behavioral therapy is that they reframe the negative thought patterns in your mind that amplify the stress responses. So they try to teach you skills and coping techniques. And there's strong evidence for CBT, actually, strong evidence from the
In managing stress.
in managing stress from the National
Wow.
Institute of Healthcare and Excellence. It reviews to show that this CBT reduces psychological distress. Psychological distress. Another way to manage stress is what? Adequate sleep. I know it's like a vicious cycle. Remember, we talked about it. One thing leading to another. Right? But if we can, so what is recommended for sleep is 7 to 9 hours of quality sleep. Because what happens is it supports your hormone balance and emotional resilience. But when your sleep is poor, the quality of your sleep is poor, it affects you and also leads to more stress. So again, it's like a cascade of events that keeps just going on. Nutrition also plays a role with stress management. When you're stressed, most people will say, "Oh, I need to grab a cup of coffee or something."
Yeah, you binge on stuff.
That's the
junks.
way to go. Yeah. Actually, one of the strategies for stress management is to limit this kind of things, limit caffeine, limit alcohol, and all of those things, and ensure that you're having that balanced diet like we talked about, right? And then above all, it will be time management, workload management like we talked about. Set realistic goals for yourself. Don't overburden yourself with goals that you cannot achieve. Prioritize your self-care. So these are all the things that we can do to manage stress.
Mollie, thank you so much. This is insightful. Now, to mention briefly on the effects of late night eating, because like I said, when there's stress and all that, someone told me some time ago that whenever she's under some kind of stress, she start binging on all these high calorie, these junks and stuff like that, and then start gaining weight and gaining weight even impacts emotionally, psychologically, and then it's a vicious cycle. It keeps recycling itself. Late night eating, because we realize that most people work late. Like you said, life is happening. This is the context. This is the world we live in right now. You just talked about 7 to 9 hours of sleep. Wow. Anyway, do you want to talk on late night snacking or eating at night?
So thank you so much for that question, Dr. Mena. Late night eating and your health. Actually, it's a very unhealthy habit to eat late at night, especially if it's within 2 to 3 hours of your bedtime. Because what happens is that your body follows a natural internal clock, right? That helps to regulate your metabolism, regulate hormone release, regulate digestion. So when you have a meal late at night, it disrupts that rhythm and affects the quality of your sleep. And at night, when your body is supposed to be sleeping, the body is less effective in metabolizing that food. So everything slows down because your body is supposed to be asleep. Something that's called the slow gut syndrome, right? Like you mentioned. So instead of being broken down, it's now stored as fat, right? And this is where we have the issues. Breaking down the food, metabolizing the food, it can't do that effectively. It affects your sleep, disrupting your circadian rhythm, so you have a poor quality of sleep. Again, it's a cascade that just keeps going on and on due to the altered metabolism. Yeah.
Wow, I'm sure someone is learning. We were just saying, I know these things are not easy in the context in which you work, everyday living. We're saying some of these things can have long-term consequences. You see, we're not by any way judging what you're doing. We're just saying, listen, pay attention to this thing, and refrain from some of these, habits that can damage your health. Mollie, give an advice to someone who is doing shift working. You're just talking about the disruption of sleep patterns, circadian rhythm, and how that the body functions in a way that it functions in a rhythmical way. And so some of these I'm working 9 shift today, and then tomorrow I'm on day shift, and all that can disrupt this pattern and cause chronic stress, and then that will impact the head eventually. Any advice, any strategy for someone who does shift working?
Okay, so my advice for those who are working shift jobs like I do as well will be, I have a few strategies that I feel are helpful. Things like planning structured meals. So you're trying to eat at consistent times, even when you're on night shift. Your body adapts better when it knows when to expect the food. So avoid continuous grazing. throughout your shift, always putting something in your mouth. Choose light, balanced night meals. So don't eat too heavy while you're on your night shift. Limit sugar, like we've spoken about. Limit caffeine intake, because if you have to use caffeine, use it strategically early in the shift. Avoid it 3 to 4 hours before, right? Before sleep. Things like water, staying hydrated, because usually fatigue is worsened by dehydration. But when you drink water regularly, right, and you stay well hydrated, that helps. With that. Things like, and then prioritize your sleep hygiene. So when your shift ends, create a dark, quiet, cool environment for sleep. What I remember recently is I would get dark curtains, right, and put in the room, so that once the shift is over, I'll make everywhere dark and it will look like it's night, just so that my body can, switch to that mode, and shut down. And if it's possible, put your devices away. I know that in this day and time, devices are a huge distraction and they impair the quality of sleep that people are getting these days. Screens with you in bed, and you're staring at your screen up until the time where you even fall asleep. And then, of course, physical activity, like we mentioned, regular exercise helps your body clock, improves your metabolism. While I cannot advise you to quit your job if you're working it, these are the few strategies that you can, apply just to make things easier
to minimize.
Yes.
Yeah, to minimize the impact on the health. Yeah, thank you so much for that. Well, now I wanted to talk about alcohol and smoking. You're talking about healthy lifestyle. Surprisingly, some people don't know, or maybe they don't know enough, I would say, because there's a patient I had recently, and I counseled him against smoking. And then they said, "Listen, doctor, this is the last day I'm going to smoke." I remember when he was leaving, he said to me, "You just saved me a lot of money." Let's see, it was just a conversation around it, and that was it. You see, so smoking and alcohol, what is the impact of the body, and what are the dangers of doing these things?
Smoking. Let's start with smoking. So, smoking remains one of the leading preventable causes of disease and premature death worldwide. WHO has brought out different recommendations and papers about this, that tobacco use is responsible for over 8 million deaths per year, including 0.3 million deaths from secondhand smoke.
Whoa.
Yes.
By secondhand smoke, I think they just wanted to explain that so we can know.
So, secondhand smoke is you're not the one who is smoking the tobacco, but you're around the environment where tobacco is being smoked. So you're inhaling that air around that environment. You're a secondhand smoker.
Wow. So wow. Okay.
And the harmful effects extend beyond the lungs. Most people think it's just the lungs, but it impacts nearly every organ in the body. Now, for the respiratory system, which is the major one that people know about, we know that it can lead to things like chronic bronchitis, can lead to COPD, that's the chronic obstructive pulmonary disease, right? And we also know that smoking is a major cause of lung cancer. In fact, it's responsible for almost 90% of cases, because the tobacco smoke itself contains over 7,000 chemicals in it, including carbon monoxide and carcinogens that destroy the airway linings. Now, if we move to the cardiovascular system, what happens there? Nicotine that is contained in this cigarette raises the heart rate and the blood pressure. The carbon monoxide that is released during tobacco smoking reduces the oxygen delivery to the tissues in the heart. Smoking also promotes what we call plaques. So that's cholesterol buildup in the vessels, right? So there's chronic plaque buildup in the vessels, and this can lead to heart attacks. It can lead to strokes. It can lead to peripheral arterial disease, where the vessels in your legs, right, all become occluded, right, as a result of smoking. There are also immune and inflammatory effects of smoking, because what happens is smoking suppresses the immune system. It suppresses your immune function, and you have issues where you have things like delayed wound healing. It increases your susceptibility to other infections, and then chronic inflammation, like we talked about, that can lead to autoimmune conditions and cancer development. And then, of course, we know the risk of cancer. So apart from lung cancer, it's important to note that smoking also is strongly associated with other cancers like cancer of the mouth, cancer of the throat, cancer of the pancreas, cancer of the bladder, right? Because tobacco smoke damages the DNA and interferes with repair mechanisms that the body is naturally supposed to undergo, and therefore fuels cancer growth. So smoking has devastating effects on the health of an individual. It also affects reproductive health. So in men, it has been shown to cause infertility, reduces sperm count, cause erectile dysfunction as well. And then in women, right, increases infertility issues as well. I have mentioned the issue of secondhand smoke, and a lot of people are not aware, right, about the consequences of secondhand smoke. And like I said, it's the smoke that is inhaled by non-smokers in the environment. But remember that secondhand smoke contains the same toxic chemicals like the person who is directly in the smoke. So for children who are exposed to secondhand smoke, it increases their risk for respiratory infection, increases their risks for asthma. It even causes something called sudden infant death syndrome. That's it. Right? Increases their risk for ear infections. How about adults? Like I mentioned in the beginning, 1.3 million deaths caused by exposure to secondhand smoke. It increases the risk of heart disease for adults, about 20 to 30% or something like that. Right? So there's no safe level of exposure to secondhand smoke. And ventilation or air filters that you put in your home will not eliminate that harm.
It's not enough. It's not enough
to eliminate that harm.
Yeah.
The dangers of smoking.
Mollie, thank you so much for that. And I think they even say, even as a small secondhand smoker, you're more at risk, because everything you're going in. I think some of these cigarettes have some filters and so on. Now, these guys who advertise these tobaccos, they usually do some kind of, what do they call it now? Disclaimer. They will say
smokers are
smokers are liable to die young, but they are still advertising it. What does that mean? These people don't really care about our health.
That's right.
You see, they don't really care. It's about the money, it's about the business for them. And the same way some of these fast foods, processed foods, high sugary stuff causes addiction in people from young age. And then you go craving for some of those things and it gives them more money. They don't really care about our health. You see, this is just a classical example. And you're saying that smoking has long-term multiple effects, vicious cycle. So the advice here is stop.
Yeah.
But are there any things that any ways medicine can help people stop? Because I know this smoking thing can become an addiction. And so some people want to stop, but then they're addicted to it and then they can't just quit. Are there any strategies, anything medicine can offer them?
I mean, first of all, what I'd like to highlight is the benefits of smoking cessation. If you are aware of the benefits, then you will definitely...
That's enough.
Right? There are immediate health benefits to smoking cessation. Statistics have shown that within 20 minutes of smoking cessation, your heart rate and blood pressure begins to drop. 20 minutes. Now, within 12 hours of smoking cessation, your carbon monoxide levels begin to normalize. Within 2 to 12 weeks of smoking cessation, your circulation and lung function improves, right? Now, within a year of smoking cessation, your risk for any coronary artery disease or heart issues drops by half, by 50%. Smokers who stop between 5 to 10 years, their stroke reduction goes down to the level of a non-smoker. And then within 10 years, lung cancer risk decreases by 50%. These are immediate things that you begin to see in your health just by smoking cessation. Like deciding that I am going to stop. not to talk of the long-term effects, like we've spoken about, decreasing the risk of all these other things. But yes, there are ways to help individuals who have addictions to these things. There are medications that are available to help with smoking cessation as well. Different types of medications. Some will come in form of a patch, some will come in form of gum, some will come in form of a tablet, depending on whichever one you want to try. And there are also resources available in terms of organizations and even specialized nurses that help people who want to quit smoking. There are things in place in certain areas or in certain countries. These resources are available to quit smoking.
Does nicotine patch help?
Yes, it does help, especially for people who are, for example, a smoker who is on admission in the hospital, right, and unable to. We've tried nicotine patches and they've helped for some people. Yeah.
Okay, because I think some of this nicotine are now in gums and things like that to help reduce the cravings over time.
Yes.
But I think what I realized is that the problem with that is that when they come off those things, then there's cravings and all this come back.
Yeah.
They're even worse off.
Yeah.
See. Yeah. Well, thank you so much for that. Now alcohol. Some we used to know that it's a little quantity or something. There's a recommendation. Tell us about the impact of alcohol on our health, and then what is the recommendation? Is this 0 level, or there's a permissible level, amount that we can take that might be beneficial to our health, like some people say or claim?
So I'll first start by saying that WHO has said that there is no safe level of alcohol. There's no level of alcohol that is considered safe. Right? So let's start off with that statement. And the fact that alcohol is classified as a group 1 carcinogen. And by that I mean it's in the highest risk category for cancer. It increases your risk for at least 7 different types of cancer, including cancer of the oral cavity, cancer of the throat, cancer of liver, cancer of the breast, colorectal cancer, all of these cancers. So even light to moderate drinking contributes to cancer risks. When you talk about heavy drinking, then we can now zone in on the liver, right? Because it will lead to fatty liver, alcoholic hepatitis, eventually liver cirrhosis, and then liver cancer, right? So these are the effects of alcohol. It also has effects on your cardiovascular system as well. It increases your blood pressure. So that's why when patient comes in with elevated blood pressure or a risk of hypertension, we always ask the question of alcohol. How much alcohol do you consume? Cut down on your alcohol, right? And like I said, there's no level of alcohol that has been regarded as safe. So, to answer that question.
So it is 0. So it is complete cessation. That's what you're saying.
It is 0, because I think it was 2023 that the WHO published that strong statement that no level of alcohol is safe for health, especially with respect to cancer risk. There's no level that's safe, right? I do know that a few countries will, however, say things like low risk alcohol level, moderate risk alcohol level, and then they'll say for you to be considered low risk, you're having maybe less than 2 drinks per week and things like that. But it's important to note that there is no level of alcohol consumption that is safe for health.
Well. Yeah. Now I wanted to beyond the health, but beyond the impact on our health. You see, I've seen alcohol ravage people's lives, with social, economical, and stuff like that. Make a comment on this as well, because all we're trying to do is to inspire somebody, to motivate somebody that listen. With knowledge, you can break that power of addiction. You see, just knowing these are the consequences, when it becomes, clear to you that these are the things that it causes. And if you do this, like you said, the smoking thing, I like to itemize it within 20 minutes, within 12 hours, that the things that begin to happen. And I've seen it firsthand. I've seen people recover. You see, I've seen how alcohol can even affect the way the skin is.
Yep.
You look at the people, this person is not healthy just by looking at them. You see, yes, please make a comment on this, how it impacts all aspects of our lives.
So I think what I'll do is I'll just group both alcohol and smoking.
Smoking,
right?
Yeah.
Both of them have huge financial and social effects on the individual. I know that the average smoker or alcoholic spends thousands of dollars annually on cigarettes, on alcohol, and on health-related costs, right? Because as a result of those two things, you're probably in the hospital more often. Now, when you quit, you save that money, and it can be redirected towards other things, right? Now, with regards to other effects of alcohol, I also like to mention that alcohol contributes substantially to injuries. So things like road traffic accidents, falls, drowning, violence, harm to others, right? And this in many cases is when someone else's drinking has caused that harm. So you can imagine the effect on the society, right?
Society, other people.
On other people. You understand?
Yes.
And then we talked about second-hand exposure. So even socially, when you quit these things, you eliminate the exposure of your loved ones to these harmful effects. And just like you highlighted, it improves your appearance, brighter skin, fresher breath, whiter teeth. When you quit all of these things, it restores your social confidence all in all. And it reduces the stigma that is associated with these vices, because there is a stigma. And above all, it sets a positive example for the younger generation that is coming. When you seize all these vices, smoking cessation, alcohol cessation, you're setting a good example for them, setting a good example for your children, setting a good example for those in the community as well. Right? So we cannot overemphasize on this point.
Yeah. Thank you so much. It's been a very insightful conversation on how some of these the things we can begin to do. I think you've given us practical steps of quitting bad habits, of developing the right habit, physical activity, eating healthy, quitting smoking, and all of that. It's really, really been insightful. Mollie, time will not allow us. There are a lot of things we need to talk about, which we'll talk about in the next episode. We'll talk about screen and all that. I want you to just round off. Somebody just listening, it's deep into some of these things, and now they realized that unfortunately some people are already beginning to feel the impact thereof, but there's a place where you can press pause and hopefully halt the progression of some of these illnesses. I want you to conclude this episode by giving a word of inspiration to somebody.
Thank you so much for having me today, Dr. Mena. This was a very nice conversation. The medicine of time reminds us that our bodies are temples. Gives step to us by God to nurture, to protect, and to steward wisely. And preventive medicine at its core is an act of stewardship. It calls us to sow seeds of wellness today so that we may reap the fruits of vitality tomorrow, just like that scripture that you had shared with us initially. And by embracing healthy living, managing stress, prioritizing our rest, taking advantage of screenings, which we'll talk about, we align our actions with divine wisdom. This is the divine wisdom of God to care for ourselves, to care for our families, to care for our communities as God intends, and as physicians for us who are believers, our calling extends beyond treating illness. It's also to restore hope and to promote wholeness and reflect God's hidden power, through the choices that we make and the care that we provide. And so I want to thank you also for leading this initiative, because when we teach prevention, we're not merely sharing medical facts. We are imparting a message of life, a message of purpose, a message of faith. The Bible says in, I believe it was Ephesians chapter 5, verse 15, it says, be careful how you live. Don't live like fools. Live like those who are wise, making the most of every opportunity in these days.
Yes.
I know that this message has come at this time to someone. So let's live intentionally. No matter how far down the path you may have gone, this message has come to you at this time, and it's a good time to just stop and rethink, and be intentional about your choices. because prevention is not just the best medicine, it's God's wisdom in action. Thank you so much.
Thanks so much, Dr. Mollie. It's such a privilege to have you on this episode. Thank you for inspiring. Thank you for giving us insightful wisdom how that we can prevent some of these things. The medicine of time. Maybe you're just listening to us. You're just wondering. Maybe you've been caught in these, in somebody's addictions, and you're maybe beginning to feel it in your body. See, what we're just trying to say is that there's certain things you can begin to do that can help you. I think the Mollie has thrown great light in some of these things, and we're hoping that we're not saying we're perfect. We're saying that we're learning as well. We're in the same journey as you. We work jobs as well that do shifts and stuff like that. We're just there's some of the things. These are some of the things you can do to minimize the damage, minimize the stress, and minimize the impact on your body. Also, Mollie quoted a powerful scripture there. I think the King James Version puts it in a way. Let us therefore walk circumspectly, not as fools, but as wise, redeeming the time. Life, there's more to life than what you see. Some of these alcohol and things that people think they're enjoyment. Or to what end? To what end? You see, we can use time to advantage. Proverbs 22 verse 3 says, a wise man, a prudent man foresees evil, and then he hides himself. This is what we're trying to say. Dr. Mollie said to the power, prevention is the wisdom of God in action. You see, thank you so much, everyone, for joining us today. We'll continue this conversation next week when we'll talk about screening and some of the things, wellness check, and what are the things you can be in, what are assessments you can trigger, how can we pick some of these things early, what are the things we can do, questions you can begin to ask your doctor. Hopefully we'll have Dr. Mollie next week and we'll talk about that. Thank you, everyone, for joining us on this episode today. We talked about the medicine of time, exploring the science of primary prevention. Until we come your way again next week, keep living in an atmosphere of faith. God bless you. Well, thank you, everyone, for joining us today. We hope you've been blessed. Join us again next week. This is Doctors in Ministry. We're medical doctors and we believe in Jesus as our personal Lord and Savior who has given us life and peace. Jesus said one day, he said, come unto me, all you who are weary and are heavy laden, and I will give you rest. If you'd like to give your heart to Christ today, please lay your right hand on your chest and say this prayer after me, wherever you are. Say, Lord Jesus, I believe in you and I welcome you into my life. I believe you're the Son of God who paid the price for my sins. By faith, I receive you into my heart as my personal Lord and Savior. Today, I receive the life of Jesus Christ, and I declare that the powers of sin, Satan, hell, and the grave are broken over my life. Henceforth, I declare that my sins are forgiven. I am born again, and I'm a child of God. Amen. Well, if you just say this prayer, congratulations. I welcome you into the family of God. Kindly reach out to us. Send us an email at info@doctorsinministry.org. We'll be glad to connect with you and to share resources with you that will help you grow your faith. Thank you again, everyone, for joining us on today's episode. Until we come your way again next time, keep living in an atmosphere of faith. God bless you.